almost immediately there was changes in heart rate variability and resting heart rate, to the point that several participants who were really into their data and really watching it messaged me and said, "Hey, I'm pretty sure I'm pregnant, even though my pregnancy test isn't positive yet." And they were.
Hello, and welcome to Pursuing Health. I'm Dr. Julie Fouché, family physician and former CrossFit Games athlete. Here, I bring you information and inspiration to help bridge the gap between fitness and medicine and support your journey toward your healthiest self. In this episode, I sat down with board-certified OBGYN and CrossFit trainer Dr. Shon Rowan. We had a conversation about guiding training for women through pregnancy and postpartum, as well as a novel research study that he led looking at trends in heart rate variability and resting heart rate in exercising women before conception, during pregnancy, and in their postpartum period. I had a ton of fun getting to know Shon at this year's CrossFit Games, and I was really excited to have him on the podcast to share his perspective and some of the research that he's doing. So I hope you enjoy learning from him just as much as I have. Before we dive into the episode, I do want to make it clear that this podcast is for general information only and does not provide medical advice. I recommend that you seek assistance from your personal physician for any health conditions or concerns. So with that, let's get to the episode. Welcome to Pursuing Health. I am really excited to be here with Dr. Shon Rowan, who is an OBGYN, CrossFit doctor, and has been doing some very interesting research as well in the area. So thank you so much for taking the time to join me.
Yeah, thank you for having me.
I thought we could just start with your background, even pre-CrossFit, maybe growing up, what kind of sports you were into or what your athletic background was.
Yeah, so I come from a childhood where we played pretty much every sport. So other than baseball, I wasn't a big fan of baseball. I think it was in first grade and I got hit by a baseball and I was like, yeah, I'm done with this. So that wasn't my thing. But I played some soccer, basketball was always my favorite sport, but being 5'8", it didn't work out real well for me. Football was probably the sport I was best at. Played a little Division III football and really enjoyed that. And then, so growing up, played a little bit of everything and just really enjoyed sports. And then when I really got into football, really got into more strength training, and that translated later into CrossFit.
Okay. And I know it's always a tough transition, especially going from playing a sport in college to then after, I guess maybe you went to med school after, and finding that new normal of how you're going to train or how exercise is going to be incorporated into your life. What was that time period like for you?
I think heading into medical school was really interesting because I imagine yours was probably structured the same way, where you had classes in the morning and then the afternoons were a lot more free time or study when you want to. So we had a good group of us, about 8 to 10 of us, that almost every day did something. And that I learned to rollerblade and to play street hockey, and, racquetball, tennis. Every day we just tried to find something to keep us active. And I think that was a very important part of just getting through medical school, just making sure that you were somewhat physically active to keep that stress down. It was actually, when you head into third and fourth year and then definitely into residency, that's when it dropped way off for me. And talking to other people that were very physically active for a long time, it seems like that's a time when they a lot of times kind of drop off too. So actually, I probably went a few years there without a whole lot of physical activity, nothing near what I do now. And that was and looking back, I think that was probably mentally a big impact on me. I think if I would have been able to be more physically active, the mental side of that would have been much, much easier.
Yeah, absolutely. I think it sounds like you had a great environment there those first years of med school, though. That sounds like a lot of fun, just having a good group to be able to do different things with and try different sports and things. But yeah, I can definitely relate to that. And I think a lot of people that I know too, just with third and fourth year of med school and then residency, with your schedule, it being a lot harder to fit in those kind of workouts. And I completely can relate to you on the mental side of things. I think just not having that time to blow off steam and to be able to exercise, it affects you, I think, mentally, emotionally in a big way.
Yeah. And looking back, life still is obviously very busy, but I think it was a choice that I could have made differently. And I wish I would have. I'm glad that I got into CrossFit and exercising when I did, because I really needed it. But I do think that I hear this a lot from patients. Well, I would love to exercise, but I'm so busy with work and I have this and I have that, and I think that, I have a job, I have a wife, I have 3 kids, I find time. And I think it's really about setting priorities. And I didn't set those priorities earlier, but that's something I've learned now. And I think that residents and medical students or any sort of professional person definitely can find that time if you just set it as a priority.
Yeah, I totally agree. And I think for me, CrossFit also opened my eyes to see, before I didn't really understand a lot of how exercise can always be modified, or you can do it in small doses, or you can find things to do. It doesn't have to be an hour-long session in the gym, but you can find something to do, even if it's mostly for that mental benefit, just to clear your head for a few minutes. And so for me, CrossFit was a big help in learning how to be more creative and fitting those workouts in, even when I felt like I didn't have time.
And that's one thing I try to tell my patients too, is, go for a walk for 15 minutes. And then do that for a while. Then you don't need to now walk for 30 minutes, walk faster for that 15 and then start running for 15 minutes, and just kind of, you can still do a lot in that 15 to 20 minute time frame, as we see in CrossFit. A lot of our workouts are 7-8 minutes and you're wiped out. And then when you can get in that 30-minute workout. So I think trying to fit, we always have this idea that we need an hour minimum to work out. And I don't think we do.
Definitely not. Definitely some of my best, hardest workouts have been just a couple minutes long. That's for sure. You think about Fran or Grace or some of those tough ones.
Which I'm sure your Fran time is much faster than my Fran time. So it takes me a little bit longer to get
used to be, maybe. I don't know about now. So then how did you eventually, you went through med school residency. How did you eventually find CrossFit?
So I was just starting to get into exercising more on my own. We were expecting our second child. My sister met a man named Jeff Giosi, and Jeff had just bought CrossFit Morgantown, and he was a very amazing athlete. You know the story, and some others may as well. Jeff was probably going to be a master's athlete at the games this year and suddenly passed away in January. But when I first met Jeff, just getting into the gym with him a little bit, I'll never forget my first CrossFit workout. So my wife she was probably 7-8 weeks postpartum, and she started training with Jeff, and they were doing one-on-one training, and Jeff would sit there and hold the baby and have her and work through workouts. And I was post-call one day, she's like, come on with me today. And I was like, okay. And I just remember thinking, I used to be a good athlete. I'm going to go in here. Jeff's going to be so impressed. And I think it was the only time I ever threw up after a CrossFit workout.
Wow.
And I don't know, I just pushed myself really hard that first time. And I was like, wow, this is hard. And then that became a challenge. It just became a challenge for me, and then I just started loving it, just getting into the gym and seeing the camaraderie and the community, and then starting to do some local competitions. It just became so much fun, and I just absolutely love it. And now I'm doing some of the coaching. I coach 3 hours a week, and that's just a whole other aspect. And I just think it was really a highlight of my week.
That's amazing. That's amazing. And I know you came to a level 1 seminar back when we were hosting the seminars specifically for physicians. What was that experience like, just learning more about the methodology behind CrossFit?
I found it to be an amazing experience. And I've told several people in the gym who are just trying to fine tune some of their techniques. And I think one of the best things to do, even if you never intend to coach, is to go do your L1, because you do learn so much that you don't think about. So for me, it was an amazing experience. It took me about 2 years from the time I got my L1 to actually start doing any coaching, so I forgot some of it. But just kind of going through a lot of those movements and understanding the ideology behind it, and even some of the nutrition talks, and just kind of getting an idea of what this is all about was really important.
That's amazing. So I'd love to talk to about what drew you to medicine. It sounds like you went to med school right after college. What was it? Did you always know you wanted to be a doctor, or what was it about medicine that drew you in?
I always knew I wanted to do something in the health field. And I don't know why, just from a young age, I was always drawn to it. I really thought I would either be a physical therapist or a chiropractor, or when I did decide to get into medical school, I thought I would go down the sports medicine path.
Mm-hmm.
I was looking the other day at, how we fill out those things as a senior where you're going to be in 10 years in high school. And I was just looking at that the other day. I found one and it said, I had written on there I was going to be a chiropractor. So
wow.
yeah, but then I'm somewhere between there and starting undergrad. I switched and knew I wanted to be a physical therapist. I was dead set on that. And then just one day during freshman year, I was like, you know what? Let's just do this. And that's where I decided I'm just going to go to medical school.
Okay.
Yeah.
But still went to medical school with the intentions of maybe doing sports medicine or something related to, what was it that, that's obviously a big switch over to OBGYN. So tell me about that.
So I think part of it was just not understanding what all OBGYN incorporates. So the surgery side really drew me in. And then the infertility side also was just fascinating to me. And that's kind of where I specialize now, is in infertility and robotic surgeries. Just also being able to help people get pregnant. I do a little bit of obstetrical care. So I see people through their pregnancy, deliver the baby. And then I have people I followed 10 years later, and they're still showing me pictures of the babies they delivered, and I think that a lot of times, especially in orthopedic surgery, unless they hurt their other knee, or they, another injury, that's the only time you're really going to get to have that follow-up. So, I just thought it really incorporated a lot of things that I love, surgery, but also just getting to know people. We go into medicine to help people, and that's that bond that you get with your patients, which I'm sure in family medicine you have even more than I do, but it's very cool.
Yeah, it was definitely a big reason for me choosing family medicine. And I think I actually probably would have gone into OBGYN if I didn't go into family medicine. I think it's one of the most, it's such a unique specialty where you can really be with women through a positive life experience, whereas in so many other fields of healthcare, it's because people are sick or because something, negative happened. And just to be able to sort of help women in that process was so interesting to me. And I loved my rotations. And I agree. I think for me, being able to develop those long-term relationships was really important.
Yeah, and I think when you do see bad things, you've built that relationship, and to have people rely on you. Now, in one way, it's like, man, this is tough. I've gotten to know you, and now I have to help you through this hard time. But on the other hand, it's also very rewarding as a physician to have that trust and to know someone. And you can see it in the patient's eyes sometimes, where they trust you. And then in the lowest part of their life, they're just happy that you're there. And I think that's an important thing too.
Yeah, it's so unique, I think, especially in OBGYN, where you get to be with women through this amazing time in their life, but there's also some of the most devastating times, like you said, and just being able to develop those relationships and walk with them through that process is really, really amazing.
Yeah.
Well, I want to talk a little bit about exercise in pregnancy. And I know that, this is a topic that, there's just not a lot of research on, there's not a lot of good information on, and a lot of misinformation and conflicting information out there. And so I'm curious, from your perspective, being someone who was so into exercise and athletics all through his life, what was it like for you as you went through your training, learning about, what we know about exercise and pregnancy and how to counsel women as they go through this?
I think it was astounding that it's just not taught. There's just it's not mentioned much. There's some bulletins from the American College of OBGYN, but they're not really focused on. I don't remember in residency really ever or medical school having a lecture on exercise in pregnancy, and even outside of pregnancy. It's only been 1960. I had it written somewhere. I forget. 1970 was the first time a woman ran the New York City Marathon. So before that, women were banned prior to 1961 from running a marathon because they were told their uteruses would fall out if they went on a long run. So
that's
it's not
crazy.
That
I did not know that.
Wow. Yeah. So, and I think it was 1970 was the first woman ran a New York City marathon. somewhere around 67 or 68, a woman had snuck into the Boston Marathon dressed as a man. And yeah, so, you're talking, what, 50 years ago. So really, exercise in women in general is really a new concept, which is astounding. So yeah, going through residency and not having the discussion of exercise, knowing these bulletins are out there that have recommendations. And it really started opening up my eyes when my wife went through, having our children, and then my sister having her children, and then, just several people having children all around the same time. And one of our friends came up to me one day and said, she was like 8 or 10 weeks pregnant. And she said, I saw my midwife this morning and she told me I shouldn't deadlift more than 90 pounds. And I deadlifted like 180 this morning. Did I kill my baby? It's like, no. And then you start asking around and nobody has any, people just have ideas, people told me very different numbers. And where did you come up with these? Like, oh, it just sounds like a good idea. So it's just, there's nothing out there. And it's a shame. I mean, women have been having babies since the beginning of time, and we've just never thought to look into this. And it's not just exercise either. I mean, it's even the way drug metabolism studies, 1% of the studies have some sort of pregnancy data on drug metabolism. So we're just guessing. So I think one of the goals of my research was just to kind of open up the field a little bit and open up exactly what we're doing here, is just discuss it. And what do we do? What is right? What is the right things in pregnancy?
And I think you hear, like a lot of things in medicine, frankly, I think it's probably magnified with women in pregnancy, but a lot of things in medicine, you hear this advice is just passed down from people who have, heard it from whoever taught them. And you look back and realize that there's not actually really good, strong data behind it. It's just kind of what we've always done. And I think, especially when you think about exercise advice in pregnancy, there's, a lot of advice about, don't let your heart rate get above a certain rate, or don't lift over 15 or 20 pounds. And I think for me going through med school, I did get the message of, have women, whatever they've been doing before, it's okay for them to continue, but don't start doing something new or something super intense. So as you've tried to navigate that, how have you, obviously there isn't a lot of data or information out there, but how do you approach counseling your patients about exercise as they go through pregnancy?
One of the first things I ask them is what have they done in the past and what do they enjoy? Because I think when it comes to getting people to exercise in pregnancy or out of pregnancy, I could preach CrossFit, and I say, I think it's a great way to train. But if you're not going to do it, you're not going to do it, Right. So pick what you're going to do. And then just kind of talking to them about what is safe, what they think they can incorporate into their life. Because they also have, they have so many social barriers too. Maybe it's their third child under the age of 3. You can't expect them to do too much. So what are they able to do? What is their environment, especially in a rural state like West Virginia? It's easy for us to say, which I think is kind of to your point here. It's easy to say you need to exercise and then walk out the door and move on to the next patient. But if they're 30 minutes from the closest gym, their husband's working off in an oil field or in a coal mines, and they have 3 kids at home, what do you expect them to do? So I think,
right. Or they've never exercised before, don't know what to do.
Right.
Yeah.
And it's not, and I think that's a very good point that we hear all the time, is don't start a new exercise regimen in pregnancy, which I think, well, what better time is there? Right? We know that pregnancy is the time that women are most likely to stop smoking, to start looking to eat better, to really think about their lifestyle changes. So I think it's the best time to try to start to get someone to incorporate some exercise. But if they've never done it, what are they going to do? They're probably going to either go really hard and burn themselves out and be too sore to move in a couple of days and then not start back up, or they're going to hurt themselves. They're going to try to do movements that they shouldn't do. And so I think that there's a huge gap there that I don't really have a great answer for. And it's really going to take some community leaders and healthcare leaders getting together and saying, how do we provide this. And I think CrossFit was doing that some with some of their home exercises through the COVID time. And I think that if I was trying to direct some women towards those, you know, they were free workouts. I think a lot of them had like, you know, a water jug or something, you know, they had different ways to be moving.
Yeah, that's so true. What was it like for you as you started? You said you did your first workout. You actually got there because your wife had gone there 7 or 8 weeks postpartum. I mean, what were your first thoughts seeing like, okay, she's postpartum, she's getting back in exercise and she's going to a CrossFit gym. How did that start to change your understanding of, you know, CrossFit or exercise during pregnancy or postpartum?
She had started doing some things even while pregnant. So just watching that was interesting, you know, just watching her kind of adapt to how her body was changing, to how her center of gravity changed, and how, you know, just all the body changes of edema and things. So, you know, just watching that was really cool to watch. And then postpartum, watching how quickly she was able to get back into shape. I think we did a mud run like 6 weeks postpartum, you know. So here she is out on a 5K mud run. And I think it was important that she had stayed in shape throughout her pregnancy, that she was able to respond very quickly and heal very quickly. You know, she had a C-section and was up moving around the next day almost as if nothing had happened. So I think it's watching that really solidified for me that exercise isn't just safe, but it's important.
How do you counsel women now? I know there's a lot of, you know, again, a big question mark, a lot of things that we don't know about doing CrossFit through pregnancy and what, you know, certain movements that may or may not be advantageous. If you know, talk to a woman who's going through, who already does CrossFit and then she's, you know, entering pregnancy, what advice would you give her? Or what points would you think are important for her to keep in mind as she's modifying?
Yeah, I think one of the most important things is to identify a coach in the gym that you're comfortable talking to and that you trust that can help you through that. And not every gym is going to have that. But I think at least having those conversations with coaches or someone in the CrossFit world of what can I do? What can I not do? And really so much of it is just listening to your body and using and actually the American College of OBGYN recommends not using heart rate as much as the Borg exertion scale. So kind of how do you feel? And so much of it is going to be listening to your body, and you're not going to be hitting PRs. You know, you need to just think about what your goal is. Your goal is to move well, keep your body in a good shape so that you can deliver a child and take care of a child, but also just without getting too much into it, is the physiology of it, the benefits of exercise and how this, I don't know if you've ever read Dr. Clapp's book where he takes the different systems and breaks them down into what exercise does and then what pregnancy does, and how the two really, there's really more than an additive benefit. So for like heart rate, for example, or the cardiovascular system, you see an increase in blood volume with exercise. You see a very large increase in blood volume with pregnancy. You see changes to the heart structure. And then when you do both, you see more than additive effect. The benefits to what your body is already needing to do to adapt, some sort of physical activity is making your body even more prepared for pregnancy, making you even a healthier pregnant woman, giving you a better delivery and a healthier baby.
That's amazing. And yeah, I'd love to just touch on that a little bit more about what we know about the benefits of exercise in pregnancy. So there's a lot we might not know about exactly, you know, how to implement it in the most effective way, but we do know there's a ton of benefits both to mom and to baby.
Yeah. And just back on to how do I counsel them as far as movement? I think you can try new movements, but don't try new movements that are going to be dangerous. Like you probably shouldn't handstand walk for the first time. You probably shouldn't try to do a muscle up for the first time. You know, you can definitely do pull-ups. So still work on that progression, right? Yeah. You can probably bear crawl. You can probably, you know, do burpees to a box, things that are still protecting your belly. And just kind of think about that your center of gravity is going to change. And the more that that center of gravity changes, you have to be more cognizant of your balance. I use box jumps as an example. There's no harm in jumping on a box. There is harm in you tripping on the box and hitting your belly, which we've all done. We all have, scars on our shins.
Oh yeah, many times.
Right? So even outside of pregnancy, that's going to happen. So when you have those balance shifts and things, it's even more dangerous. So step on a box instead. So you're still doing those movements, just scaling them back a little bit. I really think thinking about what your goal is. So many of us get in there and we're competitive and we want to do the RX movements, but it's just not a time to do those RX movements. Definitely not new ones.
Yeah, I think
if you've done them before, maybe you can still.
Yeah, I think it's just a change in that risk benefit calculation in your head of, okay, if I'm doing box jumps by myself and I fall and skin my knees, I'm willing to take that risk. I can have scabs on my knees for, a few days and I'll be okay. Yeah. But if there's now suddenly a risk of me, harming my baby, then that's a different risk benefit discussion. So I'm sure it changes things. And obviously I haven't been through it. I don't know what that, internal thought process is like, but I can just imagine it's different for every woman about what she feels comfortable doing.
Yeah.
And we know, I did want to touch on too, any specific movement. So I think a lot of women are, especially in the CrossFit world, are really cognizant of diastasis and their pelvic floor and, wanting to position themselves to have the best recovery possible. Is there anything there that you advise women on in terms of, certain movements, avoiding certain movements, or is it sort of an individual decision?
I think it's more of an individual decision. I'll be honest, that's not an area I've focused on too much. I know that Lindsay with Crossfit, I know she's done a lot of work in that area. So she was someone that I would, reach out to with questions like that. If people have specific questions, like relying on her, but definitely is a concern for a lot of women. And one I think also still needs some further research done into it.
Yeah, absolutely. Absolutely. Well, I would love to talk about your research now. So, we talked about some of the challenges of, just the lack of research. But first, why do we have such a lack of research? Why is it so challenging to study women in pregnancy? And then can you talk a little bit about the opportunity that you had for your research?
I think so much of it just comes down to liability and IRBs just not wanting to grant access to doing the research. Pregnant women have always been considered a protected group, same as prisoners and adolescents and children. So it's always going to be a little more difficult to do any sort of research with them. But it seems like pregnancy in particular has a heightened awareness among IRBs as far as their desire to let you get a research project in. It's actually to the point that in 2018, the FDA finally spoke out and they put out a statement that this is a critical health need. We got to start researching pregnancy. So with that statement, I think that helped open up, the ability to do more research, I hope. But like one of our residents and I was talking earlier, sometimes trying to protect a group is actually discriminating against them and doing the exact opposite of what you're trying to do. You're not protecting them by not including them. You're actually, decreasing your ability to care for women. So I think when we started talking about how do you do any research in pregnancy, the first step was, where do you start? And that's where we kind of developed our study, was just a baseline. And so what we did is we used Whoop, which Whoop is a heart rate variability monitor and has many other stats that you get along with it, but that's kind of the main data point. And what we did is we had women who were already exercising at least 3 to 4 times a week, and we didn't make it have to be CrossFit. It didn't have to be anything specific, although several of the women were doing CrossFit. Some were runners, I actually had a bodybuilder. So we had different people doing different things, as long as they were doing some form of exercise. And then they were trying to get pregnant. So that's where the study was a real challenge, is we needed enough pre-pregnancy data so that we could use them as their own controls, but we didn't want it so long that they didn't ever get pregnant.
Right.
which unfortunately, and we know that not everybody's going to get pregnant. So we started with 36 participants. We've had 18 that we have data on from pre-conception through pregnancy and postpartum. And we've done some early analysis. I think the statistician's actually working on it this week, looking at the whole 18. When we got to 12, we did an initial analysis and then going to hopefully look to publish it. And what we did is we are able now to define what is heart rate variability in pregnancy, what is resting heart rate in pregnancy. And we also have the sleep data and things that we're going to start to delve into more. So now we have a baseline. And also, we actually got really cool results. So what I thought was
that's always a good thing.
We just thought this would be more of a pilot study, just kind of getting a baseline. Where do you start? Because it's going to be hard to go to an IRB and say, hey, we want to study pregnant women, make them exercise when you don't know what's normal. So by using women as their own controls and doing the study in a way that pregnancy became the variable, not exercise. Now I think we have this data that we can go back, because now we have safety data, right? So if we see that we start to implement exercise in women who weren't exercising, we see these crazy changes in heart rate variability and resting heart rate from what we expect, then we know that maybe we need to stop the study or re-examine things. So now we should be able to get much larger research projects going. But what we saw was an almost immediate, the human body is just amazing. And I think that when you go through medical school, you just realize even more and more how amazing, God made us. And that almost immediately there was changes in heart rate variability and resting heart rate, to the point that several participants who were really into their data and really, really watching it messaged me and said, hey, I'm pretty sure I'm pregnant, even though my pregnancy test isn't positive yet. And they were, because they started to see those changes even before. And then amazing. We also saw the same, we think we're going to see the same. We're going to tease this out a little bit more, but right around the time of delivery, the body starts to adjust very quickly, definitely postpartum. We see a huge change again. And some of the graphs, we're going to break it down a little bit more, look like even a day or two before delivery, you start to see some significant changes.
Wow. That's incredible to think about. So can you walk us through what those changes were? What did you see that happened to HRV and resting heart rate through?
So let me just explain real quick what HRV is. So heart rate variability is looking at how your heart rate changes from beat to beat. So I think the simplest way to say it is, if my heart is beating 60 beats a second or 60 beats a minute, I'm not having a heartbeat every second. It may be 0.8 seconds, maybe 1.4 seconds, and it's varying throughout that. And women who've been pregnant or people who've been around women who are pregnant, and we see those non-stress test monitors where we watch the baby's heartbeat over 20 minutes or while you're in labor the entire time. As people outside the womb, our hearts are doing the same thing. We're having those variabilities. So we've known for many years that how the fetal heart rate varies, it determines how healthy they are. So if we see those 20, we want to see a 20 beat increase for at least 15 seconds in a fetus. We don't have those same exact parameters in adults, but we know that if you are seeing that we're in a healthier state. So when you look at the autonomic nervous system, we have the parasympathetic and the sympathetic system. Well, the sympathetic is your fight or flight. So we're trained, our bodies evolutionarily are ready to fight or flee if we need to in time of emergency. And when you are in that sort of state, which we sadly put ourselves into that state way more than we need to in this day and age, because we're not being chased by lions, but we create these stress environments for ourselves that we're almost always in this constant fight or flight state, that we're minimizing that heart rate variability. Whereas if we're in a relaxed state, we're well hydrated, nutritionally we're good, and everything is going well, then we see an increase in that heart rate variability. So and it's different for everybody. My heart rate variability last night may have been 60, yours may have been 120. And that's fine. That doesn't mean that I'm that much different than you, just that's your baseline. So that's why it was important to have
Mine definitely wasn't 120. I'll give you that. That would be great. That would be awesome if it was.
I don't think I've ever seen 120, but if I do someday, I'll let you know how that feels.
Yeah.
So we were able to have them be their own. That's why we needed them to be their own controls, because we couldn't just have a baseline number and say, how does it change? We need each person to see how they changed. So almost immediately with conception, we saw a decrease in heart rate variability. And then we saw another statistically significant decrease in the second trimester. It still went down a little bit at the beginning of the third trimester. So if you look at the third trimester as a whole, it looks like you had another statistically significant drop in heart rate variability during the third trimester.
Mm-hmm.
But what really happened was about 50 to 55 days before delivery, we saw this reversal in heart rate variability heading back into delivery, back into the increased heart rate variability stage. And almost the exact opposite happened with resting heart rate, which we've known. We know that resting heart rate goes up in pregnancy, but it's almost immediate with conception that we see the statistically significant change.
Wow.
And again, it goes up in the second trimester, into the third, and then starts to come back down with a pretty significant drop right around the time of delivery.
Mm-hmm. That's amazing. And you just think about, being able to see that, and then how women might be able to use that information, thinking, like you said, knowing maybe that they are pregnant almost immediately if they're tracking these numbers. And then, like you said, maybe even eventually being able to tease out what's happening right before delivery. Maybe that will help, them prepare, know when delivery is coming in some way. That's really incredible.
Especially if we're able to show this in some way with women who've had preterm labor in the past. If we're able to have them, I'm not saying we're going to be able to do that, but I think it would be really cool if we could.
Yeah.
And I'd be very interested to see if we see significant changes in women with preeclampsia, because I can tell you can see a woman 1 week and everything's going pretty well. They come back the next week, and all of a sudden their blood pressure's up and they're swollen, and everything's just changed so quickly, even in a week with preeclampsia. What if we could detect that even a little bit earlier? That would give us a chance to monitor them a little closer, instead of bringing them back in a week, bring them back in 3 or 4 days, or getting steroids on board for fetal lung maturity. There's different things. So there's just so many different things that we can look at, because I will say that of the 18 that delivered, I believe 16 of them delivered at term, and the other 2 were like 35, 36 weeks. So also, late preterm, all healthy. I think one person developed some high blood pressure. So we truly have a pretty good normal baseline. Yeah. So now we can start to say what happens in the different disease states.
Yeah. That's incredible. That's incredible. What are some of the other things that you'd like to see, directions that you'd like to see this research go, or questions that you'd like to try to answer?
Being someone that specializes in infertility, I'm very curious to see if we had women wearing loops during their in vitro fertilization cycles, and do we see changes in these parameters based off of how they respond to our medicines. So with in vitro fertilization, we're having women give themselves injections, usually 8 to 10 days at least, and then watching how their follicles grow. And inside those follicles, which are little cysts on ultrasound, inside those are maturing eggs. If they're not responding well, are there any sort of parameters that we can pick up on before we see them back for the next ultrasound or see them back for the next lab test? Because this is, I forget the exact number, it's like 60 readings a second or something, right, with Whoop. So we have all this data that we don't need to wait 4 days to see you back for an ultrasound. Are we able to detect anything over the next few days to give us an idea of how you're responding? I just think there's so many things that, and it may show nothing, but I think those would be some things that we can look at.
Yeah, I think we're just at such an interesting point right now where, like you said, we have the ability to collect this real-time information and it's accessible to people. And so there's so much data, and what we could potentially learn from that is huge. And I think especially the application in pregnancy is really, really interesting.
Yeah. Now, my fear, and as you probably know, is as patients do have so much access to their information, you draw labs, and then before you have a chance to look at it, they've already sent you 3 messages saying, "Hey, I saw my white blood cell count is up," right? So we want to be careful not to
cause more anxiety or
cause
worry.
more anxiety.
Yeah.
Yeah, exactly. We don't want women that all they do is sit there and watch the Whoop data and say, oh man, my resting heart rate went up 3 beats today. I'm going to, so I think we got to be a little bit careful in how we frame that. That's one of my fears of the research.
Yeah.
But we're seeing that with everything right now.
Right. Yeah, it is real. And I think, like you said, how you frame it, and for women knowing themselves, like, I think I've been really impressed by, I have a lot of patients who are, not even necessarily in pregnancy, but just say, I don't necessarily want to track my HRV or track my sleep because I know myself, and it's just going to cause me more anxiety. And so knowing yourself and saying, like, okay, what's actually the best way for you to understand information about your body? And for a lot of people, that's not necessarily in real time.
And I wonder if for some people, where I was talking about that fight or flight, again, we're not being chased by animals, but we create these stress environments. And for some people, are they actually decreasing their HRV by watching their HRV? So they're like constantly like worried about what's my HRV going to be tomorrow,
right?
As opposed to just relaxing. And so yeah, it's not for everybody. And that was a challenge of the research too, is you had to make sure that you found people that were willing to wear this for a long time, at least a year in most cases. So
yeah, it's a big commitment. Well,
so
I want to start.
Thing I was going to say something. The other thing that we saw was postpartum. It was a very quick reversal, and to the point that about 6 weeks afterwards, we actually were seeing numbers that were improved over preconception. So the data would at least possibly suggest fitness gains made during pregnancy. So when you do talk to women about scaling through the pregnancy and things where they were on a great trajectory with their health and they were hitting all these PRs and they got pregnant, we're like, well, now it's all gone. It's not. You're able to scale, continue to exercise appropriately throughout pregnancy, and you'll get back to where you were pretty quickly.
That's really amazing. I wonder what the baseline pattern would be in women who are not exercising before, during, or after, if there's the same, magnitude of change that happens. Yeah,
and that's one of the next avenues we want to take, is exactly that. Get women, but the tough part again is you need to find people that are interested in the data,
right?
Because you have to wear your loop, you have to keep it on, you have to wear it at night. I had one participant who just didn't like the way it felt at night, so she took it off every night. And then her data doesn't help me at all, because the way Whoop is, different products do it different ways. Whoop looks at your sleep. They don't show the exact algorithm, but it's somewhere in that last sleep stage or sleep cycle that they use the numbers. Then there's other companies that use your HRV and resting heart rate 15 minutes after waking are different. So for our data, we need them to wear it during sleep. So if we could find women who aren't exercising but would be interested in the data, I think that would be very, very interesting. We would just have to go with them some other incentives.
Yeah,
so
that's a good point.
The incentive was they got the data. Yeah,
right. That's a good point. It's probably if you're not interested in exercising, you're probably not going to be interested in your. Well, I don't know. That's an assumption I'm making, but it seems like it'd be less likely.
We can create incentives in other ways. Yeah, like gas cards. There's always those Target gift cards or things that you can do. Because I think that would be very interesting, and I think that is the next step we really need to take. Is what do these parameters look like in women who are not exercising, and do they differ? And then take half of those women and get them into an exercise regimen. And then so someone that wasn't exercising, but now you see them for their new OB visit around 7 or 8 weeks, and you enroll them in your study with some sort of exercise regimen. And do we see a difference there? Which I think would be very fascinating.
That would be really fascinating
to see that.
Yeah. And then you look at, all the different, the patterns with different complications through pregnancy, and you start to get this huge database of just what the baselines are, and then how can we, positively impact that. That's so exciting.
Yeah.
Well, I want to start wrapping up, but before I get to the 3 questions I ask everyone at the end of the podcast, could you just leave us with sort of your top message that you would like women who are doing CrossFit, that are thinking about getting pregnant or maybe are pregnant, what message would you like to leave them with?
I think the number one thing is listen to your body. Set appropriate goals. Think about what your goals are, and kind of keep your eye on the prize, which in this situation is a healthy pregnancy. Mm-hmm. And then also that afterwards you can get back to where you were. Mm-hmm. Your body's going to be different, right? I mean, this idea that your body's going to be the same after delivery just isn't true for 99% of women. Mm-hmm. So you're not going to be the same, and your sleep's going to be different. Everything's going to be different because now you have a child. But as far as your fitness goals, I think a lot of them can still be achieved pretty quickly afterwards. So don't stress over that. Listen to your body and keep your focus on what you're actually trying to achieve, which is a healthy pregnancy.
Mm-hmm. I love that. Well, 3 questions I ask everyone at the end. The first is, what are the 3 things that you do on a regular basis that have the biggest positive impact on your health?
3 things that have a positive impact on my health. I think one thing that's very important to me is I read my Bible every morning and every night. Mm-hmm. And to me, that's just a great way to start and end the day. Mm-hmm. And I think that just kind of gets me in the right mind frame. I think number 2 would be really trying to pay attention to nutrition. I think mm-hmm. it's something that was not taught well in medical school, and I think it's an area that you could ask 10 nutritionists a question, you're probably going to get 10 different answers. Mm-hmm. So just kind of learning my own nutrition and what works for me. And I can tell you days that my nutrition is off, I'm very different. Mm-hmm. And then I think the third thing is just exercise. I mean, if I go a couple of days without exercising, my wife is like, just stop what you're doing, go work out, and then come back.
Things will be better. Yes.
Yeah, and it is, it's so true. And like we talked about it, even if sometimes I have 10 minutes, yeah, and I'm gonna go do something for 10 minutes. I'm gonna row mm-hmm. really hard for 10 minutes. Mm-hmm. Something to get moving. So I think my walk with God, nutrition, and fitness are 3 things to get me through the days.
I love that. And I just love the sort of the concept of giving yourself, making sure you have what you need, mentally, physically, spiritually, emotionally, and kind of keeping that as your baseline to be able to be at your best. And it's not always, it's like this balance, and maybe your wife notices, hey, it's time to work out, or maybe, mm-hmm. your nutrition's off for a day and you're like, hey, I don't really feel the same. Or, I notice the same thing if my morning time, with prayer reading gets cut short, or I oversleep or something, the day is just not the same. So I think, yeah. Those are all amazing. And I definitely notice the same in my life.
And I would say the other thing, just to make another quick point, is that probably the biggest highlight of my day is that my wife and I work out together, and mm-hmm. we really try to carve that time out. And for any couples out there that maybe your partner is not working out, or that they're thinking about it, and just that time together, and especially as parents, where the kids know when we get home, or they go to the gym with us, mm-hmm. and they love that, and they've seen us in the gym, and they just don't know anything different other than just people mm-hmm. exercise, right? So I think that marriage-wise is one of the most important things that we do, is just mm-hmm. have that time together.
I love that. And just the example you set for your kids of this is important, and this is a normal part of our daily life, and them sort of growing up with that message, I'm sure is going to serve them really well. Mm-hmm. What's one thing that you think would have an impact on your health, but you have a hard time implementing it, or something you're working on?
Sleep.
Yeah.
I think just appropriate sleep. And that's not an occupational thing, because a lot of people are like, oh, you're an OBGYN, you probably never sleep. I have a pretty good life, really. Working in an academic center, I'm not on call like these OBGYNs they don't have any help for 200 miles, or they're on call 24/7. Mm-hmm. It's really just a matter of just getting my mind to shut down and mm-hmm. telling myself to sleep appropriately. That's by far the number one thing I need to work on.
Love it. I can relate. What does a healthy life look like to you, Shon?
What does a healthy life look like mm-hmm. to me? That's a tough one. I think that's where, so my sister talks about having different buckets in life and trying to keep them all full. So there's the spiritual bucket. I'm not going to be able to name them all off the top of my head, but there's the spiritual, emotional, physical, financial, relationship, and trying to keep all of those at an optimal point so that no matter what hits you. And I think that she's a perfect example of this because, you know, she's 34 years old, has a 1 and 3-year-old, and her husband suddenly dies out of the blue, you know, and people that saw her strength through that, you know, she's horribly sad, of course, but the way that she was able to be strong and continue to do the things she did, she points back to that and says, you know, I maintained all of those different aspects of my life so that when one got devastated, I didn't have to try to fill the other ones as well. And I think that's what a healthy life looks like, is one where you have that balance of all those different aspects. And I think so much of that plays into, you know, your occupation. If your job just sucks and you're miserable every day, it only takes one little hit in one of those little other areas, you know, then say that you throw your back out. Now you're just done, right? So now you've hurt 2 of those buckets. So I think picking each of those spots and just trying to find, and work's not going to be great every day. Marriage isn't going to be great every day, but trying to just keep a balance across those, I think will keep you in that healthy state.
That's so beautiful. And I appreciate you sharing so much too, just about Jeff, even him getting you into CrossFit and about your sister's resilience. I told you before I listened to another podcast that you did, just talking about that experience and your sister, and just how I was blown away by her resilience and how she's, it seemed like just had such grace through this whole situation. And it does remind me a lot of, you know, when we talk about the sickness, wellness, fitness continuum, creating this buffer with our physical fitness, it's almost like we can do the same thing with each of those buckets, right? Like for whatever life's going to throw our way, whether it's a physical challenge that comes up and we need to have some physical reserve, or whether it's a mental, emotional, relational, financial challenge, and we have that buffer, that reserve whenever life throws something our way. And how, you know, I think CrossFit is a great way for us to develop a lot of those, like, you know, mental, character strength, physical strength, all that stuff, the relationships that we have in the gym, but really paying attention to each of those buckets for us, and knowing that they're not always going to be in perfect balance, but if we can do our best to be aware of each of them and keep them as full as possible, then, you know, ideally we do have that reserve when something happens. So I think that might be my favorite answer to that question. And I've asked it a lot, I think over 200 times.
I have to give Sarah the credit. That's my sister. Give her the credit for that one. Yeah.
Wonderful. Yeah. And I'll link to in the show notes to the other podcast that you did, and some other links about, you know, Jeff's story. And so people can learn more.
Okay, great. Thank you.
Wonderful. Well, I really appreciate all of our time together and just all the work that you're doing. Just being who you are and, you know, being in the gym with your family and your wife, and coaching and all these things that, you know, you wouldn't think. You think someone's so busy, you know, as a academic OBGYN, doing research, 3 kids, wife, but like still taking the time to coach and care about members at your gym is really amazing. And taking the initiative to do research like this in an area where we have such little information, and just, it's exciting to think about, you know, now where we'll be 5-10 years from now, the information that we'll have, and how we'll better be able to guide women through pregnancy. So thank you.
Yeah. Excited for the future.
Thanks so much for tuning in. If you enjoy listening to the podcast, please consider subscribing and giving it a 5-star rating on iTunes. It really does help to get the word out to more people.